The Caribbean Public Health Agency CARPHA joined the region in observing World Tuberculosis Day on Tuesday. The day is used to build public awareness that TB remains a major global health problem, responsible for illness among 9 million new people each year and deaths of 1.5 million. Worldwide, TB ranks as the second leading cause of death from an infectious disease after HIV. This year's theme, Find, Treat, Cure TB, focuses on TB diagnosis and case detection of those still not reached. TB remains a public health priority for the Caribbean region, with more than 30,000 new cases occurring every year. Progress toward TB control in the Caribbean has been slow, despite recognition that increasing trends for the disease pose a threat to the public. Meantime, the senior medical officer for infectious diseases in St. Lucia's Ministry of Health says despite the low incidence of TB here, the ministry remains vigilant.
When someone has TB, and that is active TB, they show symptoms such as the person has chest pains. They may be coughing, and when they cough, they will be coughing, but when they cough, they bring up mucus that could be blood stained. They also complain of having fever, night sweats, weight loss, feeling generally unwell. And these are symptoms you would see in someone with active TB. That person has the ability to infect someone else, especially if they're living in the same house with the person, or they work on a day-to-day basis with the person, or they're around that person constantly. Then that person with active TB can infect someone else.
In such cases, the person who gets infected can develop latent TB or active TB.
Latent TB is the form of TB where you don't show the symptoms that I mentioned prior. However, the TB, the bacteria is within your body, and when you have illness or you have a sickness that will weaken your immune system, whether it be because you're an older person, an elderly person, or you may very well have HIV, that person who had the latent form of TB will start developing the active form of TB, which is the TB with the symptoms and the signs. What we advise people to do is to ensure, if you have the symptoms I have mentioned prior, that is chest pains, you're coughing, you're bringing up sputum, it's blood stained, you have fever, night sweats, weight loss, you see your healthcare provider. It could be that you have TB, but it could very well be you have something else, some other respiratory tract illness that needs medical attention. And of course, if you find yourself being exposed to someone with these symptoms, you need to see a physician. Because we have treatment at our public healthcare facilities. We have treatment for persons with TB, whether it be active or latent TB. And that treatment is free of cost to the patients.
Dr. Alicia Deborah Eugene there of the Ministry of Health.